welcome to another episode of Love Southwest Florida. Today we are with Dr. Giselle Prado with Exert Clinic. Giselle, how are you today?
Doing great, Marcella. Thanks for having me on the show.
Of course. Dr. Giselle, how about you give us a little bit of your background? Where do you come from and how much do you love Southwest Florida?
Well, I'm actually pretty new to Southwest Florida. I've been here for about a year and a half now. I got married and my husband is a local, so I'm really liking it. I grew up in Miami, so just across the state, and I think that this is a great place to raise a family. I have a new baby at home. As far as me and my background, I'm a medical doctor. I'm trained in internal medicine, and I have a small business. It's female owned, and I'm the medical doctor. I do a weight loss clinic. I have an aesthetic side where I'm pretty successful with my botox and fillers, and I also have in-office liposuction and skin tightening with minimally invasive procedures that have been getting some really great results.
So I actually got a couple of things with Dr. Giselle. And I know a lot of people try not to talk about it, and but I love talking about it because I just think it's good, and I just think we should take out the stigma of cosmetic procedures and everything. Something I absolutely adored was the lip fillers, and I've gotten a lot of questions from our followers from that. And Dr. Giselle is here, so she can help us answer some of them. How can someone know that you're not going to do too much lip filler? What aesthetic view are you going for when you see someone?
So my motto really is that the best injectables are undetectable. So you never want to leave my office looking like you're overfilled, overdone, unnatural. So I'm very conservative as an injector. I try to show everyone that one syringe, specifically in the example of lip filler, it's a very small amount. So to put it into context, if you were to take a tablespoon, one syringe equals 1/5 of that tablespoon. So you need 5 syringes to make 1 tablespoon. So with that small amount in the lips, if you're only doing 1 syringe at each visit, you can really, decide how voluminous or hydrated you want your lips to be, and it won't look overdone.
Yeah. So at first I was a little bit scared because obviously, like anything you do to your body,
swelling too.
You have swelling. How long does the swelling take to go away? I know it depends on each individual. Mine went away pretty fast. Some other people last longer, but what's the average?
So you can expect swelling for a maximum of 2 weeks. So anywhere in that 1 to 2 week frame. Most people, as soon as I'm done with them, they think, oh my God, my lips are so big. And once the swelling goes down, they actually tell me that they missed the look that they got from the swelling immediately after the filler.
You also do Botox. What is a normal amount of units that one should get? Because I know some people are like, oh, just give me 1 unit, 2 units, but that's really not a lot. That's just a drop.
Right. So in the bottle of Botox, Dysport, or Xeomin, you're getting about 100 units. So if you're doing a full face treatment, I'll tell you right now, just between the forehead, the 11s in between the eyebrows and the crow's feet, you need about 50 units. If you're going to add in the lower face, like the chin or the muscles that pull down the corners of the mouth, the lip flip, then you're looking at closer between 60 and 70 units. So, when people come to me, they hear these numbers and they think, oh my God, that's so much. But really, it comes down to the strength of your muscles and how many areas you want to treat. It's a muscle, so the more that you dose the Botox to the muscle, the longer results that you're also going to get, so that you won't have to come back into my office in 2 or 3 months. You can extend that to maybe 4 to 6 months.
Awesome. So Dr. Giselle also offers some weight loss programs, and after you reach your weight goal, she offers some liposuction, in-office liposuction, and skin tightening. How does that work?
Yeah, so it's a great procedure, especially after you've lost weight and you have a stubborn pocket of fat. So maybe the under chin or looseness in the lower abdomen or the arms. The patient is awake the entire time. So that's what's really great about this procedure. It's entirely done under local anesthesia. It's not uncomfortable. I've had lots of patients actually fall asleep while you're doing it because you're breathing in a laughing gas, kind of like what the dentist offers, and you get really comfortable. You don't really feel much. The downtime is so minimal. If you do it on a Friday, you can go back to work on Monday. You do have to wear a compression garment for a few days, but otherwise, the activity is really not limited. Just don't go to the gym and start lifting heavy weights for 2 weeks.
Does it work like regular in regular liposuction? Does it take away the fat cells and
Mm-hmm. So similar to regular liposuction, what's really special about my practice is I'm actually the only one that has a device for skin tightening. It's called Renuvion, and it uses plasma energy to tighten up the skin after liposuction. Because generally, when you do liposuction, you're removing that fat and the skin is still there. So in order to help contract the skin, you use this Renuvion device immediately after liposuction, and the results are just amazing without having to remove any skin.
pain is minimal compared to like a tummy tuck or
Yeah, so with a tummy tuck, you're actually removing the skin. So you're cutting, you're making big incisions, there's stitches. With this procedure, you're basically have a really small entry point. If you've ever been to a dermatologist and had a skin biopsy, that's the same tool that I use in order to get access to that fat.
Dr. Giselle, I know you just recently finally moved to a new office. Congratulations. I know it took a little bit to get that
Thank
office.
you. It's a very hot real estate market.
Yes. Yeah, you got it here in the worst part of
Yes.
the real estate market. So, where are you located now?
So I'm right off of Daniels and US 41. If you know where the Costco is in Fort Myers, my office actually is behind that. So I'm at 13730 Cypress Terrace Circle, Suite 401. If you hit the Fred Astaire Dance Studio, I'm right next to it.
Dr. Giselle, how did you start on this? So I know you did medicine, and then what drove you into going into the aesthetics part and the cosmetics part?
So I'd always been really active in the research world. So even in medical school, I'd done a book chapter about lip fillers. I'd done another book chapter about transferring fat from areas that you don't want fat into the buttocks. So I already was kind of aware. I'd worked with a couple of plastic surgeons and dermatologists. But it wasn't until I connected with a colleague. She's a plastic surgeon up in North Florida, and she's also running her own business. She's solo practice, similar practice to me, in that she does weight loss and then the aesthetic procedures. And she really gave me the confidence that I could do this on my own also. So I decided to, train under her and learn all about these techniques, and went out on my own, and it's been just a wild ride since I started. And I'm so happy that people in Southwest Florida now are learning more about me. I'm getting great results, so I'm happy to take consultations and meet as many patients as possible.
Oh, I actually love that about you. I can tell that you do a ton of research and that you're very well educated in what you do. One thing that I loved when I went to see you was that you explained everything as it was going to be. And I had never done lip fillers before because I was scared that I was going to look like a duck, or that I was going to look crazy or like a porn star or something weird,
For the pain too.
Yes. So as after I talked to you, I was like, oh, I feel confident enough that this is going to be a natural look, which I didn't think as soon as I left your office, because I was just swollen and I was like, oh my God, what did I do to myself? And I was like, oh no, she did tell me it's going to be swollen. And then everything you said was right on spot. It was 2 weeks after and my lips looked perfectly fine. It gave me a natural look, even with the Botox too. So I really appreciate that you're very well educated on this.
Thank you for saying that, Marcella. If you read my Google reviews, a lot of them mention that I really take my time to explain everything. I know that when you're going to a doctor's office or getting a medical procedure, it can be really overwhelming because you don't do this every single day. You don't know what you're getting yourself into. So I try to make my patients as comfortable as possible. And that means doing a lot of education before I do anything to you.
I love it. I love it. Dr. Giselle, what's one thing you love about Southwest Florida?
What I love about Southwest Florida, honestly, just the pace of life here. It's a little slower than Miami, where I grew up. So for
Yeah.
raising my family, I love that, people say the traffic here has gotten worse, and I think, oh, I just breeze around. This is great. I love that there's so much waterfront dining and access to the beaches and waterways. So I just love the pace of life here.
Yes, definitely. I I keep hearing too the complaints about traffic, and after living in Miami, it's just like
Like you have no
that's
idea.
nothing. Like this is just easy. I can never complain about traffic. Dr. Giselle, what inspires you daily?
Really inspired by the patients that come to me and they put their trust in me. They're willing to go forward with this plan. It's usually they come to me because they're unconfident about a certain thing, and they say, well, this line right here, this is the reason that I can't do a big smile when someone takes a picture of me, and I'm so self-conscious. So I'm inspired by the fact that they went out of their way. They called me and they want to make their lives better, and they leave my office just being so confident about their new look and radiant that it inspires me to keep going and treating as many patients as I can to help them too.
Dr. Giselle, if anybody wants to find you online, how can they find you? Give us your website, social media handles, and give us your phone number in case they want to schedule an appointment with you.
Yeah, so my phone number is 866-37-EXERT. So that's 866-373-9378. My website is exertclinic.com. Exert is spelled EXERT. And on social media, I'm pretty active on Instagram under exert.clinic. And I also have a Facebook page, facebook.com/exertclinic.
You can also find her on TikTok, and I've seen very
Yes.
educational TikToks, and I like it.
Yes, I'm getting the hang a little bit more of TikTok. It's user friendly. I'm just not sure what all the buttons are for. So, what a 15-second TikTok takes me a half hour.
It usually does. So I do TikTok, and it takes me 2 hours to do a 30-second TikTok, and
A good one, yeah.
it's hard. Dr. Gisela, it was very nice talking to you. Thank you so much for being with us today.
Thank you for having me, Marcella.
Of course, and everybody, I will hear you guys again on next Monday. And you can also find us on Instagram, Facebook, and TikTok at Love SWFL. That's Love Southwest Florida. Thank you, everyone.